Hi, everybody. It's Donna Nauman, functional medicine nurse practitioner. I help patients who go to the doctor and still don't feel good or don't understand what's really going on with them. Today, I'm going to be talking about brain health. I had a lot of questions after the last video, so I thought I'd go over some of the neurotransmitters of the brain and how each of those things can affect the brain differently. When the brain gets inflamed, it begins to have symptoms, and those symptoms are very different depending on which hormone, which chemical, what's actually going on in the brain. So the first one we're going to start with, and I kind of have a list up there, you can look at it. The words are kind of big, they're medical, but whatever, we'll figure it out. The first one is acetylcholine. When patients are having issues with acetylcholine in the brain, they usually have some kind of problems with visual or photographic memory. They can't remember spatial things, so they may get lost when they're driving. This is a very common thing for people who have problems with Alzheimer's. They can have acetylcholine issues. If you catch it early, like you catch it in the beginning stages, sometimes you can correct the acetylcholine before those neurons are burned out and the brain doesn't function anymore. So if you're thinking about somebody and they have mental slowness or they're having memory lapses, it's super important for them to get tested quickly and try to get that reversed before it kind of goes down that whole panel into Alzheimer's disease. Once that happens, it's very difficult to reverse it, and we have very few medications that really help that. The second one we're going to be talking about is serotonin. Serotonin is probably one that most people are most familiar with. We have the most medications for this. So we have things like Zoloft, Prozac, Lexapro. We have a whole plethora of serotonin reuptake inhibitors. And basically what it does is it allows more serotonins to sit in the middle of the receptor sites. So the serotonin keeps getting picked up by the next neuron and the next neuron and the next neuron. When we have a serotonin issue, you may feel issues of depression, you aren't sleeping very well. You may have some times where you're feeling like this inner rage inside of you, or just you don't have any pleasure. You lack the ability, don't want to do anything. You just tired all the time and you just have no energy. So this can be a complication of many things. If you think about everything that I talk about, there's never just one right answer to the problem. When we think about serotonin, we also have to think about melatonin and to think about estrogen and testosterone. So our hormones. So for people that are on like birth control pills, and if they have high estrogen levels, those are going to cause a dysfunction in the serotonin levels. Women who have menopause, when they're not making any estrogen, that means that they're not sensitizing the cells anymore to the serotonin. So a lot of times when women are going through menopause, they have that sense of sluggishness, the sense of don't want to do anything, loss of pleasure. And it may not be depression. It may just be that their estrogen levels are too low and there's not enough estrogen to make the serotonin work. It's like, this is so complicated. And, when you go to the doctor's office or whatever, you don't get all these explanations. So I think this is super fun, like learning like really what's going on. If you have a serotonin issue, you can also have a tryptophan issue. So tryptophan is found in many of our foods, and we need that in order for things to transport in and out of the brain. Tryptophan can be found in foods like salmon, shrimp, spinach, liver, and mushrooms. So if you don't have a very variety diet, maybe you're not getting enough of the helper things to help move the serotonin into the synapses. So that's pretty cool. Like diet, people don't realize like all of our vitamins, all of our nutrients, our amino acids, our fats, good and bad, our vitamins, our electrolytes, all of those things coming from the food or the water or the drinks that we drink. And so those things are what actually makes all those chemicals inside the body really work. So if we're doing the SAD diet, which is the standard American diet, we're probably not getting a lot of the really good nutrients that we need. Not too long ago, I did a talk about the nutrients in our soil are completely depleted. So every time we're growing food, the food is growing in a soil that has been pretty much wasted. And so a lot of the nutrients that the plants need are not coming up in the plants. And then we're eating a lot of processed foods, and those processed foods are really, they're inflammation foods that we eat, and they make the body become inflamed because it's man-made, not God-made. So really thinking about diet and the foods we eat to help promote good brain health. This other thing with serotonin to be thinking about is your melatonin levels. So a lot of times when people have serotonin issues, they don't sleep very well. They come in the office and they're tired, they're not sleeping, and they're depressed. So if you have a lot of cortisol issues from stress, it'll begin to throw off your melatonin levels. If the melatonin levels get thrown off, then our sleep cycle gets thrown off. So now we're not only tired from all the stress, we're tired because we're not sleeping enough. So melatonin has a lot to do with our sleep and wake cycles, and serotonin needs melatonin in order for it to properly work. So again, going right back to all these pieces of the puzzle, trying to make everything work together. So you would know you would have a melatonin deficiency if you're having issues with depression, you're feeling moody, tired, you get migraines, depending, like light migraines or not enough light can cause migraines too. So if you have those, sometimes that's what's related to low melatonin levels. And the next one we're going to talk about is GABA. GABA is probably one of my favorites because GABA is something that we don't address very well. If you're having a serotonin reuptake problem and you put people on Prozac and they get better, or you put them on Lexapro and they get better, it's really targeting in on that serotonin. But what about those people that have anxiety and panic attacks and feel anxious all the time? They're overwhelmed for no reason. There's like nothing big going on, but they just can't seem to handle life. They're very disorganized. They're distracted. Everything is like going on around them. And they're just like fragile about everything. That's a GABA issue. And we don't really talk about GABA issues a whole lot because, you know, our biggest drug market right now is for serotonin. GABA is really related to Xanax. So anybody that does well with Xanax usually has some kind of GABA deficiency or something going on with their GABA receptor or their GABA nutrient, or they're not moving the GABA around the brain appropriately. Things that can really are integral with the GABA is things like gluten. And I know people think, oh, gluten, that's just like an over talked about word and whatever, but gluten sensitivity and gluten intolerance and gluten, you have an immune response to gluten, it can also cause problems with our brain. We don't think about food as causing inflammation or causing us to have problems with our memory. But I'm telling you, I've seen Alzheimer's patients get better getting off of gluten with the SHAPE program that I use. I've seen people that have fatigue issues, chronic fatigue issues, get off gluten and feel better than they've ever felt. Whenever I use the SHAPE Reclaim program, I see big changes in people as far as weight, inflammation, pain, and brain function, as well as many other things. But what I'm telling you here is that diet is so important. It's integral to living longer and living healthier and living in a space where you're actually functioning optimally. And who doesn't want to be functioning optimally? I think I kind of really, I like the GABA because I think I really resonate with it. It's kind of like who I am. I run late for everything. I like to watch TV, be on the internet and look at my phone all at the same time. And I'm very easily distracted and I'm late for everything. So it kind of goes along with that whole GABA problem. Another thing that really is affected, that can affect our GABA, is thyroid. So if you have an autoimmune disease, and you take thyroid medicine, it's possible that you also have this issue with the brain function as far as GABA goes. So if you have a lot of the things we just talked about and you have thyroid problems, it's quite possible that you have a GABA issue, and that getting on some support to help your GABA receptors and your GABA neurotransmitters would be really, really important for you. So those are just a couple things about, I think GABA, that's probably just my favorite, mostly because I resonate so much with it. I'm like, I am late for everything. I am lateman, Donna Nauman instead of Nauman, it's lateman. So the next one I want to talk about is dopamine. Dopamine is, you ever have, you see a teenager, and they're just kind of hopeless and everything is worthless and they just lack motivation and they just can't get themselves going and they're just, don't want to do anything. This is dopamine. So dopamine has to do with, are we able to get up and do things? It has to do with addictions. So dopamine is our pleasure. It's what makes us feel good and calm and everything is going well. It's our coordination and how it can have to do with Parkinson's disease, people that have tremors and things like that. So people that have an issue with the neurotransmitter dopamine, they have low libido, they have a reward system issue. So they need things to boost up their dopamine. So what do? They drink, they smoke, they gamble, they have sex addictions, they have all these other things that they're trying to upregulate this pleasure center. So it's interesting too, people that have Parkinson's disease have a lot of depression and anxiety symptoms too, because of this pleasure center. And so sometimes when they put patients with Parkinson's on medication that kind of corrects this, they start gambling. And so physicians or practitioners will tell their spouses to like kind of lock out the checking account until they see if the patient is going to have a reaction to being started on the medication. I think that's so interesting. This dopamine is also a place where you'll see a lot of ADD kids, those attention deficit disorders, because of this reward system and the dopamine really calming things down. If they lack that, then they often have symptoms of ADD, that concentrating, they can't focus, they don't do things right. So those are kind of our neurotransmitters. And then I just want to talk a little bit about, so you learn some things about neurotransmitters. What can you do to make it better? Well, I practice here in St. Louis, and the things that I like to do is always start with diet. I have seen over and over and over and over and over and over that food is medicine. If you just can respect that, yes, it is difficult to ask people to stop gluten. Yes, it's difficult to ask people to stop stopping in at McDonald's. But honestly, wouldn't it be better for you if you were eating a healthier diet and you felt better and your brain was functioning better and you were like totally able to coordinate your life better and you were sleeping better? Is it so much to ask that you eat better? And I'm not saying not ever to go out to eat. I'm not saying never to do that. But what I'm saying is to adopt a program in your life that is really about really feeding the cells of your body. So that's so important. Getting your blood work is always important, making sure that you're not anemic, making sure that your thyroid looks good, checking an insulin level to see if you're pre-diabetic, or if you are a diabetic, you can kind of think through all the lists we just talked about, and maybe you have a lot of these symptoms because you are a diabetic. When those blood sugars are out of control, the sugar is not getting into the cells very well. It's stuck in the blood. When it's stuck in the blood, it doesn't get to the brain. The brain needs sugar to convert and do the work of the brain. It's the energy source of the brain. So when we have diabetes and our blood sugars are 300, 200, 400, I've seen them all the way up to 1,000 or more. And when those numbers are like that, your brain is not functioning well. You are not making good decisions. And so getting those sugars back down to normal, getting the weight up, maybe using the Shape Reclaim program that I use, or you can do vitamin supplements that I use. Like I use all kinds of different ways to help people lose weight, but really focusing on getting those blood sugars better so that you're thinking and feeling and sleeping better. I use a lot of supplements when it's appropriate. The nice thing about these neurotransmitters is I actually have questionnaires that you can fill out, and it helps us really tune in to which one of those neurotransmitters seems to be your issue. So it's very individualized to you. So really trying to figure out which one of these is going wrong. Sometimes it's all of them. And we have to use a broader type neurotransmitter supplement that helps. It's not actually the neurotransmitters, because you can't take the neurotransmitters, it can't cross the blood-brain barrier, but it is the vitamin supplements that help all the neurotransmitters do a better job and helps it move back and forth through the blood-brain barrier. And so in that way, it's more of a supportive way. But again, you have to do the work. If you want to feel better, you have to begin to eat better. That's like the number one thing. There's not a supplement in the world, a medication in the world that's going to work better for you than sitting down at the table and eating a good, healthy meal and making sure that you're drinking plenty of water every day. 75% of Americans are dehydrated, for heaven's sakes, and dehydration causes hypertension. So let's get better drinking our water. The other things that you can do is start exercising. When we exercise, it increases the blood flow to our brain. Well, if we're increasing the blood flow to our brain, we're bringing more oxygen and we're bringing more nutrients into our brain, and it's causing the brain to work and do the things that it's supposed to do. Sleep is super important. So if you don't sleep well, you should really be thinking about, why do you not sleep? I use a book called Why We Sleep, and we try to really figure out what the sleep issue is for people. I know it's probably one of the hardest things is to figure out why people are not sleeping. Some of it's habit, some of it's these neurotransmitters, some of it's our hormones, testosterone, estrogen, progesterone. So if you're menopausal, sometimes progesterone will help your sleep cycle better. If it's a testosterone, low testosterone, sometimes replacement with that will help too. We do that for women and men, so either one. But sometimes sleep has to do with our cortisol and our stress levels. So if our stress levels are horrid, there's not a drug that's going to make you stay asleep because you're stressed, your melatonins are off, your cortisol levels all over the place, your vagus nerve, the epinephrine, norepinephrine, all completely whacked out, sympathetic, parasympathetic, all a mess. So correcting stress becomes super important. Sleep is so important because when you're sleeping, your body is getting rid of old things and replacing those old things with new things. So it's cleaning. It's like the cleaning time. So if you're not sleeping, you're not cleaning. The brain isn't cleaning out the things it needs to clean. The body isn't cleaning out. So very, very important. Sleep apnea is like such an overlooked thing. I probably 3 to 4 people a day were diagnosing with sleep apnea, with people that didn't think they had any symptoms at all. But if you have weight issues and you can't see the back of your throat, the uvula, which is the little thing that comes down in your mouth, then you may have sleep apnea and you should be tested. Then people get sleep apnea too. The symptoms of sleep apnea would be snoring, fatigue all day long, breaks in sleep cycle, waking yourself up because you're snoring so loud. And then you don't necessarily even have to be a snorer to have sleep apnea, but often people do, because when we fall, our head falls back, the tongue falls back into our airway and it causes us a. So anytime you have a sleep break, like you're sleeping, you're snoring, and then you stop, it's called apnea. So you can even, like, I've taken my phone and I've recorded my husband while he sleeps, just so that we could see what he's doing. And then we laugh about that because I think it's funny. Brain fog, unclear thinking, slow mental speed, poor focusing, poor processing can all be symptoms of brain inflammation. Sometimes people have had brain injuries in their life and they have some of this brain fog or these unclear thinking patterns or slow speeds. This is always a sign that some kind of inflammation is going on in the body. And again, first thing we're thinking is, how do we reduce the inflammation in the body? And it's all the same things that we've been kind of talking about: getting the blood sugar down, making sure you're sleeping well, eating well, getting your nutrients, doing supplements if it's appropriate, seeing a primary care doctor if it's appropriate. And so really trying to rule out all the bad things. If you rule out all the bad things and you're still having symptoms, that's kind of my juicy spot, helping people feel better when they've been to the doctor and they still don't feel good despite all the tests being normal. So this is just a little about brain health. Brain health is so important. And I like feeling good. I like running, I like exercising, and all of that I can do because I'm taking good care. I'm taking my vitamins, eating nutritiously, exercising in the water. And I'm not trying to like be, hyped up. It is a lot of work. Exercising is a lot of work. I don't like it just like everybody else, but it can be one of those things that feeds the brain the necessary chemicals that it needs. Because for me, exercise really settles down all that nervous energy that's inside. So anyway, this is what we have for today, brain health. If you like it, say you like it. If you like it, send it to somebody else. Let people begin to learn that there is more than one way to good health. If you are taking SSRI, serotonin, uptake inhibitors like the Zoloft, the Prozac, the Lexapro, Paxil, and you're not feeling better, it might be something else. So there it is. Pass it along because I think everybody could use this. Being healthy is a holistic approach. There is not one thing that is going to cure all things. And so when you think I'm taking antidepressant, I'm going to feel better, you probably could be doing a lot more to make yourself feel better. So this is about hope. This is about having hope and finding a space of feeling better because you know better. So that's what I have for today. See you next time.